Hi guys, in this video I would be talking about the revenue cycle management in US healthcare. So how revenue flows, how a revenue is generated in a healthcare industry. So for a revenue to be generated for in a healthcare industry or in a hospital or for a provider, that starts from a patient. So the patient walks into the front desk and he would schedule an appointment. So at the front desk, the patient's demographic details, that's the patient's general information, and the insurance details would be collected, and after that an appointment would be scheduled. So it need not have to be that the patient has to always walk in. So the patient can either call the provider, schedule an appointment, call the front desk and schedule an appointment, or he can log in into the provider's website and schedule an appointment, or using the provider's app he can go ahead and schedule the appointment. So anything can happen. So he need not have to be always walking in for an appointment, and he has to provide in the demographic details and the insurance details. And then registration and the insurance verification happens. So an account would be created for the patient with that particular hospital, just like the bank account, and then the patient's insurance verification happens. So whether the patient has an active insurance policy, or whether the treatment which the patient is about to get treated for, will that be covered by the insurance or not. So that would happen. After that, patient walks in during the appointment date, he gets the treatment. Once the treatment is given, so that treatment, or whenever the physician or the doctor is treating the patient, he might either use a super bill or a dictaphone recorder or a voice recorder, or the physician might directly enter the treatments into the EMR, that's your electronic medical record. So these cannot be forwarded to the insurance for payment. So what the provider would do is he will hire a medical transcriptionist basically. So what medical transcriptionist would do, he would listen to the raw data or the data provided by the physician, either the super bill or the recording, and the medical transcription team or the medical transcriptionist would create medical records for that particular treatment. Once that is done, then comes medical coding. So as the name itself indicates, coding. So the medical coding team receives these medical records, and they would assign medical codes for the TX, that's your treatment, and DX, that's your illness. So they assign codes to the treatments and the illnesses. Once that is done, now the claim is ready to be billed out. So the charge entry team and the billing team, they enter these codes into the provider's application and file out the claims to the insurance company. So it can be through electronic or through paper. So once the claims are billed out, the insurance would either make the payment or the insurance might deny the claim. So if the provider has followed the guidelines of the insurance might pay the provider. If the provider misses on following the insurance guidelines, maybe the insurance would deny them payment. So the provider would receive the money if the insurance guidelines are followed. So the provider would receive the money. Along with that, the provider would receive the EOB or ERA. So this EOB or ERA would be received by the payment posting team, and the payment posting team would post these EOBs or ERAs into the provider's application. Once that is done, then if there's anything which is left out, or maybe the insurance denied the payment, so as that might go to the accounts receivable or the denial management. So as the name itself indicates, accounts receivables, so the amount which has to be received, that's your accounts receivable. So the amount whatever the provider has to receive, either from the insurance or from the patient, that would be collected by the accounts receivable. And denial management, as the name itself indicates, so whatever amount is stuck at the insurance end and they are denying to pay, so the person would try all the possible ways of collecting that particular amount. So that's your denial management.